We're all in the business of being involved in sports because we want to help children and athletes become not just better athletes, but better people. So when we have events like this, I think it's really important to understand that you're treating a person, especially as a physician, but also as a coach, not an athlete. So you want to keep a better, bigger perspective on how you can impact that individual's life and certainly teams of individuals. So when we have these types of events, the idea is to really look at each individual person and how you as a parent and coach help make that person better, not just as an athlete, but as athletics as a venue. Understanding the problem, so education, which is another great reason why we have venues such as the one we're doing today, help athletes, parents, and coaches understand the things that we're dealing with. Because as a clinician, nothing is harder than to sit down with an athlete or a parent who is focused on just getting back and they're not really conceptualizing what's happening on the inside. Physicians by definition want to help people get better, and having the athlete be able to understand that there's a process here, and if they can contribute themselves to that process, then the whole thing becomes much easier. The second thing I think that's really important are rule changes. When you can't directly prevent something, it's all about risk modification. So if we can change the way the game plays ever so slightly, for instance in soccer, reducing the risk of heading in younger athletes, while that hasn't been shown to directly correlate, it is something that provides a lot of hope because it fundamentally makes sense, right? The athlete is taking less hits to the head from a ball or colliding with another athlete while trying to head the ball. So we're reducing exposure. So that exposure reduction can potentially over time lead to decreased rates of concussion.